Hi, my name is Dr. Jay Uomoto. I am the Senior Clinical Research Director for the Traumatic Brain Injury Center of Excellence here at the TBI and Intrepid Spirit Center. And we are conducting research to do near-term clinical application to improve warfighter brain health as well as to facilitate return to duty. Let me tell you about two studies that we're working on at the present time. The first study is a brief intervention called MSPIR, which stands for Mindfulness-Based Stress, Pain, Emotion, and Attention Regulation. This intervention was developed by Commander Bill McNulty, who is a clinical psychologist who works with our first group here at JBLM. And this intervention is meant to reduce post-concussion symptoms and help our participants cope with these symptoms. It is a brief 5-session intervention. Each session is 90 minutes long, and we ask our participants to practice about 15 minutes of mindfulness practice per day. We feel that this is doable for our active service members and yet effective for these symptoms of chronic pain, stress, emotion, and attention regulation difficulties that they face. Our hope is that our MSPIR intervention could easily be implemented in other settings outside of a specialty traumatic brain injury clinic. A second study focuses on developing a method of real-time symptom tracking using smartwatch technology. We know that many symptoms of traumatic brain injury fluctuate throughout the day, and knowing these fluctuations of symptoms can help us more precisely develop specific interventions that address some of their symptoms. Our smartwatch app is named the Clinical Symptom Tracking and Assessment in Real-Time System, or CSTAR, and was developed in partnership with the Madigan Army Medical Center Department of Clinical Informatics. The app delivers very brief questions several times per day, and each question requires no more than about 3 seconds to respond, thus reducing response burden. In this manner, we're able to obtain a high number of data points throughout the day and week, more so than you can with traditional questionnaires alone. Thus far, we have developed surveys for headaches, mood, alcohol use, fatigue, pain, and cognitive symptoms. The symptom patterns obtained from this type of time-intensive data can help us predict a person's symptom profile in the future, but it will also in turn help us to develop what's called just-in-time interventions. More research is needed to refine these methods for regular use in a clinical setting. However, we anticipate that our CSTAR system will eventually be generalized beyond use in traumatic brain injury, but could also be used in other clinical settings such as primary care, behavioral health, family medicine, and other specialty medicine clinics.